I don't know, there was some problem in the connection.
Okay, no problem.
We were talking about the review. They should be reviewed regularly. Okay, especially for the growth, development, and organ function. Referral for specialist assessment should be made if puberty is delayed beyond 14 years in girls and 14.5 years in boys. So if there is delayed puberty also, but usually it's considered pubertal delay beyond 13 years for girls and 14 years for boys, right? In the
Yes.
we have read like that. Anyways, you just remember delayed puberty, you will refer to the specialist assessment as well. So about the parental and patient education, any situation which precipitates crisis, that is cold, dehydration, exhaustion, baby getting tired, playing too much and getting tired, can cause dehydration and vaso-occlusive crisis. So any avoiding situations that can precipitate crisis such as cold, dehydration and exhaustion, and early recognition and treatment of infection. So whenever there is infection, better to go and get checked with the doctor. So this parental education has to be given about the fever, cold, dehydration and exhaustion. Then palpation for splenic size to ensure early presentation of splenic sequestration can significantly reduce deaths. So as we discussed, we should teach the parents about the palpation of the splenic size, because if they think that the spleen is starting to enlarge, they can present early and we can prevent the death. Ensure early presentation of splenic sequestration can significantly reduce death. All patients should be advised to avoid alcohol because its dehydrating effects, and smoking because it may cause acute sickle chest syndrome. So especially if teenager or something, you should advise for this, avoiding alcohol and smoking, because alcohol can cause dehydration effects and smoking will predispose to acute sickle chest syndrome. Folic acid supplementation may be required. Zinc supplementation should also be considered if growth is restricted. Vitamin D deficiency is very prevalent in non-white children in the UK and may coexist with sickle cell disease. So advice should be given regarding vitamin supplementation. So it's general, but folic acid must, you will mention, and zinc and vitamin supplementation is your choice. Then psychological good support of patient, families and other carers is very important. Cognitive behavioral therapy may be indicated if they have behavioral issues. Then infection, how do you control? Oral penicillin prophylaxis is started at diagnosis. So if you get the by screening, if you think that this child has sickle cell disease, you can start by 3 months. Otherwise, anytime at diagnosis, you will start oral penicillin prophylaxis. The risk of pneumococcal infection remains high, but decreases with age. There is steady rise in prevalence of penicillin resistant pneumococci now. Though you are giving penicillin prophylaxis, there can be resistance. You have to be careful with it. Penicillin prophylaxis is considered throughout the life in some countries, but is stopped at age of 5 years in other countries. Why he is not telling about UK?
Yeah, this one I was telling to someone, because I have read this one. Some countries they are telling 5 years, and in UK they are giving the throughout life, I think.
Okay.
Yeah.
But in UK, he didn't mention particularly as UK. In some countries, other countries he has mentioned. Maybe if
in one of leaflet which I have studied maybe 2 years back, they have mentioned 5 years. That was also for NHS. And in other books I read that no, this is throughout life.
Okay, say throughout life or 5 years,
yeah,
upon the country. That's it.
Yes.
Routine childhood vaccinations could include protection against HIV, and conjugated vaccines against Streptococcus pneumoniae is most high in most high income countries. Children.
Dr. Noor, sorry to interrupt.
Yes.
Just a small question. For example, such a dilemma, whether to continue throughout life or stop at the age of 5 years, can't we say they will follow up with the specialist,
Yeah.
for instance, a hematologist, and he will decide if prophylaxis should be continued for a long period of time? Is this considered a wrong answer?
No, it will not be considered. Anything you don't know, you can refer, sure, for
Yeah,
sure. Or you
okay.
can consult.
Okay,
Consult
dear.
or refer anything, no problem.
Okay, thank you.
Next is see, conjugated, usually they are giving in many high income countries, what he has written, most high income countries, they are giving as routine in vaccinations against HIV and pneumococci, that is Streptococcus pneumoniae. But here you should also emphasize that children should also receive unconjugated pneumococcal vaccine from 2 years of age, repeated every 3 to 5 years, and an immunization against meningococcus, influenza, and hepatitis B. I don't think unconjugated is given as routine, right? It's not given as routine. That's why he is telling they should also receive a pneumococcal from unconjugated from the age of 2 years, and it should be repeated every 3 to 5 years.
Because unconjugated, you don't give.
That is why here you have to mention particularly that you will give unconjugated also in these children.
Yes, because before 2 years, you give them conjugated vaccine. So that's why they are mentioning from 2 years of age. And then you repeat every 3 or 5 years. Usually they do 5 years. 5 years they repeat.
Yeah, but in the routine immunization of normal children, they are just giving conjugated. They're not giving unconjugated.
That's what I'm saying. They give the conjugated. That's why they are mentioning here unconjugated.
So we should emphasize this point when we are telling about immunization to them, that we will consider even the immunization of unconjugated pneumococcal vaccine, and also immunization against meningococcus, influenza, and hepatitis B. But most of these will be given. Meningococcus, influenza, I don't know. Here it is not given as routine. Only in the whoever needs in the winter months can take influenza. Because malaria is significant cause of morbidity and mortality in patients with sickle cell disease, malaria chemoprophylaxis is often recommended. This you can consider in the areas endemic to malaria, like in Africa. But sickle cell trait is protective against this, right? Sickle cell trait has an protective against malaria, but not sickle cell disease. That's why he's telling the sickle cell disease children can have significant mortality and morbidity. And in endemic areas, you can consider chemoprophylaxis. Next, blood transfusion. Transfusion therapy is the key intervention in decreasing morbidity and mortality in patients with sickle cell disease. So how you would give transfusion? Transfusion may be required for severe anemia or reduced proportion of HBS if there are lung and central nervous system complication. That is acute chest syndrome and central nervous system. But usually in stroke, they consider exchange transfusion. So next is coming. Partial exchange transfusion rather than top-up transfusion is indicated when it is necessary to reduce percentage of HBS quickly in acute life-threatening complications such as acute chest syndrome, acute stroke, multi-organ failure, and urgent preparation for major surgery. So two things you can give: just blood transfusion, what we call it as top-up transfusions, or partial exchange transfusion. Again, it will be decided what you want to choose, blood transfusion or partial exchange will depend upon the child's condition. If the condition is acute life-threatening, like severe acute chest syndrome or acute stroke or multi-organ failure, and you want to prepare the child urgent for major surgery, and you want immediate reduction in the hemoglobin S percentage, you will go for partial exchange transfusion. Otherwise, even in some cases, you can just consider the blood transfusion. Okay, iron overload is possible complication for regular transfusion, and iron chlination should be started in all children receiving regular blood transfusion. If they have regular blood transfusions, like what happens in beta thalassemia major, if these children also, whoever needs regular blood transfusion should be monitored for ferritin levels, and iron chelation should be considered. Next, hydroxyurea. Many cytotoxic drugs increase fetal hemoglobin concentration, which is potentially beneficial for patients with sickle cell disease. Benefits include increased hemoglobin concentration and decreased platelet and white cell counts. So this, along with the increased hemoglobin, they will also decrease platelet counts and white cell counts. So you have to monitor these things also. Concerns remain about myelosuppressive and teratogenic effects, and it is possible long-term toxicity. So hydroxyurea should be stopped at least 3 months before conception. So they will have myelosuppression. As we said, there can be decreasing in the platelets and white cell counts. This is the side effect. If they ask, you should know the side effect of hydroxyurea. Even here he has mentioned it will come under the category of cytotoxic drugs. Okay, so there can be decreased platelet, white cell count, myelosuppression, teratogenic effects. So 3 months before conception, they can stop. How hydroxyurea helps? Hydroxyurea can reduce frequency of crisis in sickle cell disease, episodes of acute chest syndrome. The need for blood transfusion is also reduced. It is not yet licensed for use in sickle cell disease. It should still be used only on named patient basis with close hematological supervision. So if you ask about license of this drug, it is still not licensed. It is being used as unlicensed drug, but the benefits from the drug, like the sickle cell crisis, vaso-occlusive crisis is reduced, acute chest syndrome and stroke episodes are reduced, and also the need for blood transfusion is reduced. So they are considering it, but you should, there is an effect of cytotoxicity with reduced platelets, white cell counts, myelosuppression. So you have to monitor the hematological parameters, has to be monitored. Just 1 minute. Okay, so bone marrow transplantation, hematopoietic stem cell transplantation is potentially curative, but is currently used in only patients with severe clinical course and matched sibling donor. Usually the preferred is the sibling. You should have a matched sibling donor, and children with severe clinical course they are considering, and it is curative. Its use is limited by toxicity and the availability of suitable donors. I think the toxicity he is talking about the immunosuppressive drugs which we use after transplantation, right?
Yes.
This is what he is talking. Yeah. So again, they will consider benefits versus risk. That is the toxicity, and also they should have a matched sibling donor. Next, prevention of stroke. This is very important. Stroke prevention. It is recommended that transcranial Doppler ultrasonography performed annually in children aged 2 to 16 years with sickle cell disease, and that regular blood transfusion should be considered in those with abnormal findings on transcranial. So it's not mandatory that the child should have stroke before. He is telling here, any child diagnosed with sickle cell disease from the age 2 to 16 years, after the age of 2 years, till 16 years, they will do annually this. That is transcranial Doppler ultrasonography performed annually in children aged 2 to 16 years with sickle cell disease, so that the regular blood transfusion should be considered in those with abnormal findings. Suppose you do and you think that there is a possibility they can develop stroke, the blood transfusions will be considered. Then assessment and prevention of nocturnal hypoxia. Suppose if the child has obstructive sleep apnea, this can precipitate vaso-occlusive crisis. So you have to assess and prevent where when relevant may be important in preventing strokes. So obstructive sleep apnea can also be considered as a cause here, and you have to prevent it. Exchange transfusion should be performed when stroke occurs. Suppose you have to know this, in transcranial Doppler ultrasound, there is some abnormal finding. At that time, you can just consider the transfusion, regular blood transfusions. But if the child has stroke, you will give exchange transfusion. Exchange transfusion should be performed when stroke occurs. Stroke is considered an indication for bone marrow transplantation in children and adolescents who have siblings with identical HLA. So identical HLA siblings, stroke is one of the indication to consider for bone marrow transplantation. Then acute chest syndrome. Treatment includes inspired oxygen, incentive spirometry also used for pain crisis with back or chest pain, continuous positive airway pressure, CPAP, and exchange transfusion. Occasionally, ventilation may be necessary. So main thing is the oxygen, continuous positive pressure, ventilation, and exchange transfusion. But I did not understand what he's telling about incentive spirometry. Anyone? What do you mean by incentive spirometry? We have to go back and check on, just mark this point and know what he's telling.
This is that one, the one you give usually the spirometry for the post any surgery or in the cystic fibrosis, then you have to increase your lung compliance. This is a small device. You will just like balloon, you will give the blow to that. It will increase your lung compliance.
Means it will increase the expansion of the chest.
Yes, lung compliance, expansion. You will see how much you are able to blow it up. It's a small device. They will give you like balloon. You will make it, you will blow it, and you will see that there is a small like mercury type of small of the round. It will go up and down by your blow. So it will see how your lungs are compliant, how much you can blow it up. Usually they give it also during that when you give this check for the asthma patients, post-salbutamol.
It's like peak flow meter or what?
Yeah, when they will check the peak flow meter, they will check that time also. They will give the same device them to check the lung compliance.
No,
this is just to increase. Dr. Noor, this is just to increase the lung compliance.
Lung compliance. That's what I'm saying. This is just to increase the lung. Even after post-surgery, you are afraid of the lung collapse. So you give them.
Before, if somebody has worked in surgery, before if they are doing any surgical procedure, they are doing just balloon in our countries to increase the lung compliance. So they have made this spirometer. So they are called its incentive spirometer. They are using this one to increase the lung compliance only.
We can tell like it's an exercise to increase.
The lungs. Just exercise to the lungs. Just you will increase the compliance of the lungs. Like you are afraid after post surgery, you are afraid that you might have collapse of the lungs. So you give the patients to do this like inflating the balloon. You will just inflate this one just to increase the compliance of lung.
Okay. Next is antibiotics are given using combination of macrolide with intravenous cephalosporin. Okay, usually antibiotics is considered. Cephalosporin.
You can check that picture I have sent in the group, Dr. Noor. Incentive spirometer. Okay.
I will, inshallah. Then transfusion or exchange transfusion produce improvements with several uncontrolled studies. So transfusion and exchange transfusion will be decided by the consultant or the hematologist depending upon the HbS in the body. Okay, they just need transfusion or they need exchange transfusion. Then hydroxyurea decrease the episodes of acute chest syndrome in one multi-center studies. Periodic transfusions is also effective in preventing recurrences. Again, priapism is an emergency requiring hydration and analgesia. In minor episodes, bladder emptying exercises such as jogging, warm baths, and analgesia may help to abort. But in major, you have to give also, you have to also consider exchange transfusion in these patients. If prolonged episode, aspiration or irrigation of corpora cavernosa with adrenaline is the treatment of choice, then here advice, children and their carers should be advised to seek treatment early and should attend the hospital as soon as emergency if priapism persists for more than 2 hours. So more than 2 hours is then indication for exchange transfusion. Okay, contraception, no need. If you want, you can read, if you want to give any advice for teenage girls. So usually pain from vaso-occlusive crisis results from oxygen deprivation. So oxygen is your this, and avascular necrosis of bone marrow can also happen because of the oxygen deprivation. Then dactylitis is more commonly early manifestation that may occur before the age of 6 months. Okay, uncommon after 2 years. So 6 months to 2 years, it's common. As we know, cold, fever, dehydration will increase the vaso-occlusive crisis. Okay, so 90% of the hospital admissions is from the painful crisis. Okay, to occur up to 30% of the days with loss of 10% of school days. So school, in the history case, taking about the school history and mentioning is very important because these painful episodes can cause 10% of school days absence. Okay. And they also can occur 30% of the days, means 30 days out of 100, they can have pain, and 10 days out of 100, there can be absence of school. Again, hydroxyurea can reduce frequency of painful crisis in sickle cell disease, unlicensed indication in UK. Again, same thing, avoid exposure to cold, fever, dehydration. Most episodes coped with a home respond with simple oral analgesia, increased fluid intake, warmth, and rest. So what is the ladder? You will start with paracetamol or ibuprofen. If necessary, weak opioids like codeine. You can remember codeine enough for mild pain. Then always look for cause if there is infection. Admit patients if does not subside promptly. If there is need for strong opioid treatment, strong opioid like morphine, you can consider. If fever, pallor, signs of respiratory compromise are noted, you will admit. Benzodiazepines can helpful for reducing anxiety. So pregnancy, no need for us. So whenever they are going for surgery, they can have complications like acute chest syndrome and pain. So pre-operative transfusions to decrease the risk of, so as we said, even if there is urgent major surgery, if emergency, you can also go for exchange transfusions. Otherwise, if it is elective, you can consider pre-operative transfusions to prevent acute chest syndrome. Travel advice, again, increase fluid intake, abstinence from alcohol, physical movement during travel, including flights, are helpful because again, you know, flights, we fly high, so it can precipitate the attacks. Anti-malarial prophylaxis is essential for traveling areas of malaria. Patient should increase overall fluid intake about 3 liters per day for adults when they are in hot climates. Okay, so whenever whenever it is summer or hot, you will encourage increased fluid intake. Okay, gene therapy is nowadays they are considering, but still not. Sickle cell is a good candidate for gene therapy because normal phenotype can be restored in diseased cells with single normal copy of mutant gene. However, there is currently no research evidence. You can just mention if you want in the last. So one is the chronic pain, nocturnal enuresis, osteomyelitis, hyposplenism, stroke, priapism. All these we'll read in detail. Just cardiac failure, left side heart disease occurs in about 13% of adults. usually not in children with sickle cell disease, is mainly caused by diastolic dysfunction, which is the increased risk factor for mortality. But he's telling mainly in adults, so don't write. And even this chronic pulmonary disease may be due to repeated acute chest syndromes and lung infarctions, but this is again older than 30 years. Gallstones from chronic hemolytic anemia, they can have retinopathy, retinal infarcts, retinal hemorrhage, retinal detachment, again all due to vaso-occlusive crisis. Retinal infarcts, hemorrhage, detachment, retinopathy. So with the transfusion complications is the iron overload and organ damages, because we yesterday read in thalassemia what iron overload can cause the organ damage. And also there is alloimmunization, exposure to possible infections also. Chronic leg ulcers can be there, avascular necrosis of the femoral head, humeral head also. Then chronic organ damage. It is due to two reasons. One is vaso-occlusive crisis. Another is they have regular blood transfusion from iron overload. So vaso-occlusion, hyperhemolysis, increased blood viscosity are the major causes of chronic organ damage. You may have renal failure, lung ulcers, liver failure, osteonecrosis, retinopathy. Then chronic kidney disease also you can causes worsening anemia and may require treatment with high doses of erythropoietin. Okay. I think rest of the points are not that important. You can just go through yourself and make notes only of the important headings, because we just discussed too much because we should know the points. But in the exam, it will be just 3 minutes discussion of the important points. So just make the important notes about recent things, some recent things which is not mentioned in the mark. Otherwise, it's good. Okay. So any comments before we end the meeting?
Noor, please share this on the group, please.